3 examples we have picked this week from the system. But I have an opportunity and the Kenyans are watching. We found a patient who has gone to hospital 5 times in one day. The system picked. In the morning he was there, he said he had an ear problem. In the evening, at midday, he said he had a stomach problem. And these patients, so the collusion of fraud is between, some of them are patients, health facilities, and healthcare workers. 22 doctors have been denied access to the SHA and digital health system. Over 40 clinicians have been denied their rights because of fraud. And this will continue. We have found somebody who said his dependents are 375 children. I'm sure Senator Sifuna and myself, where we come from, where we are, because I saw Bungoma. Bungoma is leading in terms of children, you know. They told me every month in that hospital alone, 400 children are born, which is very, very good. Even from us, I don't think where there is somebody who has a dependence of 372 children. And that person is from Kwale, and the DCI is investigating. We have found men who claim to have over 50 spouses as dependents. We have found women. We have, I'm sure even Khalwale doesn't have 50. We have found men. We have found men who claim to have over between 50 and 70 spouses as dependents. So what is going on in Kenya in terms of fraud? This is what used to happen in NHIF. But I want to tell them that the transformation that is taking place in our country with the support of this House, because the laws that we are using, the social authority, the chief, the regulations were all passed by this House, and of course the budget. Thank you very much.
We now move to question number 031 by Senator Catherine Muma. Senator for Nairobi City County, informed through a letter that you've been nominated to ask that question.
Indeed, Speaker, I have. Speaker, in this conversation, for as long as you hear people saying SHA is working, but there's always going to be a problem, and these questions by Senator Catherine Muma are pointers that there are issues still, and we must keep asking these questions despite all the backpatting that we've seen from some of my colleagues. This is the question by nominated Senator Catherine Muma to the Cabinet Secretary for Health. Number 31A. Honorable Speaker, what is the rationale for the 18-year age restriction in access to hearing aids under the Social Health Insurance Assistive Devices Benefit Package? B, when will the discriminatory age restriction be removed so as to allow adults with hearing impairments to access hearing aids under the SHA Assistive Devices Benefit Package? C, what is the ministry doing to address the high cost of hearing aids in Kenya? And could the Cabinet Secretary state whether there are plans to procure and distribute hearing aids through the Kenya Medical Supplies Authority or other government procurement channels to make them affordable? And lastly, Honorable Speaker, could the Cabinet Secretary outline the long-term strategies in place to enhance access to quality health care by persons with hearing impairments and provide details on government's plans to train and recruit additional audiologists, establish hearing care centers in every county, and integrate ear and hearing care into primary health services to facilitate early screening, among other interventions? Thank you, Honorable Speaker.
Honorable CS, you may respond.
Honorable Speaker, the temporary 18-year age restriction on access to hearing aids is not intended to be exclusionary, but rather serve as an interim core containment measures driven by the current resource constraint within the scheme. I say this because the prioritization of individuals up to 18 years was strictly informed by the critical importance of hearing in speech, cognitive development, and educational attainment during formative years. So it also factors in the long-term socio-economic impact of early intervention, aiming to minimize the clinical outcomes within the limited physical space. On question B, Honorable Speaker and members, this restriction is not permanent. SHA, working with the Ministry of Health, we are currently undertaking a very continuous actuarial assessment to evaluate the affordability alongside resource mobilization and benefits within the scheme. So we are working on a very progressive benefit expansion to include adults. And this will be planned and it will be implemented soon. But this is a function of the expansion of benefits for this age category will be guided by a body that is in law called Benefit Package and Tariff Advisory Panel, which must submit a report by September, which is mandated to review and advise on benefit design, the cost effectiveness, and how do we prioritize. So we have written, SHA ourselves, we have written to, is part of the things we have told the whole, a whole set of issues to be reviewed and for them to advise us on benefit design and the cost effectiveness. So this one is with that committee, and I'm sure they will make the right decision for the benefit of Kenyans who are in this category. What are we doing as a ministry to address the high cost of hearing aids? I agree that we recognize the high cost of hearing aids remains a very critical barrier, and it's very, not only in Kenya, in many of our African countries. It has become a barrier. It has become a barrier in terms of access. Hearing aids typically cost between 40,000 to 150,000. With most devices, again, are imported on a very small scale. They are sold through private outlets at prices which are unaffordable to the majority of our citizens. These challenges, Honorable Speaker, again is compounded by the limited audiology services outside the major urban centers. So the people who are suffering more are our Kenyans who are in the rural areas. Then again, as the Senator for Nairobi, on behalf of Senator Muma, has raised, we have a very serious shortage of trained specialists as a country. And we heavily, again, there's a heavy reliance on out-of-pocket payments. So the people at the bottom of the economic ladder suffer. And it also affects the whole concept of universal health coverage. So it brings the issue of inadequate access, particularly in rural counties. This again is further aggravated by the fragmentation taxation. There is an element of tax. While the VAT cap 47 accords preferential treatment to complete hearing, and I remember when I was the National Assembly, we removed that. But it was not done in a very structured way. Some aspect of it, of these hearing aids have been removed, are still holding some taxes as ordinary parts. So all these costs put together are passed to the user. So we need to address a whole ecosystem, a whole area where we feel ultimately we should reduce the cost. We are working with suppliers and importers and vendors, Honorable Speaker. Good example is, I said last time, we have reduced the cost of breast cancer, the drug that is used for breast cancer, from 120,000 to about 40,000. We are talking to other big pharma companies. Have an MOU with them because the cost of care, cost of drugs in our country is very high. But we have standardized specification for basic, mid-range, and advanced hearing aids in Kenya, assistive technology specification list, which will be incorporated into the Kenya Essential Medical List, which will allow us, this specification will be used to aggregate the national demand under the Social Health Insurance Fund. So that we see whether, leveraging on the economies of scale, we can use KEMSA to go and buy in bulk pool procurement, and then talk to manufacturers and lower the prices. So it's something that we at the Ministry of Health are tackling, and I'm very happy the Honorable Senator has raised. But through the 80 Scale Initiative, which we are working with the Clinton Health Access Initiative, we are now procuring over 2,000 hearing aids for distribution to all our public health facilities and hospitals. And why is this? We are building on a very initial phase that has already equipped 27 facilities with the screening and diagnostic tools across multiple counties. So, Honorable Speaker, I have instructed KEMSA that hearing assertive technologies be now integrated into the National Logistic Management Information System, must be integrated into our Kenya medicine list that KEMSA and MOH has, and then we increase the screening and the diagnostic tools across multiple counties. Finally, the Ministry of Health, Honorable Speaker, will engage the National Treasury this year during the finance bill to propose amendments aligning the tax treatment of all hearing aids components, including essential parts, accessories, and consumables, are aligned and they are tax-free. This will help us ensure indispensable components of hearing aids are treated as integral medical device for persons with disability, rather than ordinary taxable spare parts, thereby reducing the out-of-pocket cost and advancing universal health coverage for persons. So we want to make sure that once that tax is removed, they can be financed and paid for under the Social Health Authority tariff. But the National Council for Persons with Disability has already initiated a framework agreement to strengthen the public procurement pathways of the whole country in terms of hearing assistive devices. Honorable Speaker. Honorable Speaker, what are our long-term strategies in place to enhance access to quality health care by persons with this condition, with hearing impairments? The ministry is implementing the National Ear and Hearing Care Strategic Plan 2023-2028. This is a very comprehensive framework, and it's designed to expand both ear and hearing services across all levels of care in our health ecosystem. And this plan helps to establish hearing clinics in all the sub-counties and integrate prevention, screening, and treatment into the primary healthcare services under UHC. So to strengthen the workforce, our community health promoters, our maternal and child health nurses are being trained both at our middle-level colleges, at our universities. They will be trained in prevention, in early detection, and in referral. Concurrently, the University of Nairobi and KMTC and the Kenya Institute of Special Education are also scaling up how they can produce more audiologists and more speech, language, and therapists. Honorable Speaker, when I saw this question, I had to talk to the DG who is here. And I can confirm that as a country, we have serious shortage of specialists, even speech therapy. Even when we put the cochlear implant into our children at tender age, they recover very easy to hear. But the biggest problem is they recover and they take long on the speech therapy. So it's something we have seen, and I think we will talk to our training institutions and more Kenyans and to bring the curriculum and work through. Thank you, Honorable Speaker.
Senator Sifuna, do you have any supplementary question?
Indeed, Speaker, I do. Unfortunately for me, the ODM expert on PWDs is not in the House today, Senator Crystal Asige. But I do, if my memory serves right, we did pass as a House an amendment, Honorable Speaker, And I thought we touched on this question of taxation of assistive devices. It just doesn't make any sense why a government would impose VAT on essential components such as hearing aids. But I want to assure the minister that we'll be following up when that tax conversation comes up to see that this government actually does away with taxation on those essential hearing aids. But since the CS has pegged down the capping of receipt of these assistive devices to 18 years to the cost of the product. And if you look at the response, it's saying that it is a cost containment measure driven by current resource constraints. Does the CS or the ministry have empirical numbers? How many people above the age of 18 in the country, or what percentage of the population is actually in need of these things, so that we actually know that it is a heavy cost to government and you're not just telling us stories? Because you've told us here you are undertaking actuarial assessments, which I believe must be based on data and numbers. Do you have those numbers, Waziri, on how many people above the age of 18 in Kenya require these assistive devices? I thank you, Honorable Speaker.
Senator Duale.
Thank you, Mr. Speaker. A quick one. Waziri, I have a patient who has a heart problem and currently admitted at Tenwek Hospital, Bomet. Now, what I'm getting is that SHA is paying 537,000.
Now, Senator Duale, you know the subject of the
my question,
the
Mr.
subject
Speaker.
of the primary question.
Mr.
You know
Speaker,
it.
I'm building my case. It's
Okay.
on SHA. I'm just inquiring.
Yeah, but the question at hand, the primary question, is
Mr.
actually on the devices.
Mr. Speaker, I raised my request earlier on when actually Senator Hamida was on the floor. And
So
even
it's not
before.
related to this question.
No, it's on SHA, Mr. Speaker.
I will allow you.
Thank you. So, Waziri, this patient is in the hospital and the bill is about 1.1. SHA is paying 530 something. The patient is supposed to pay the balance. Mostly on heart problems, people actually seek where they can be able to get quick response to their issues. I'm told there are criteria, or rather there are categories of payment for different hospitals and different diseases. So I really want to know more specifically on that particular patient or heart. I have about 4 patients from Isiolo who are having similar challenges, actually going around to raise funds to meet the cost of the operation. So do you have categories of hospitals and diseases that you pay different charges, especially those patients who are covered under SHA? I thank you, Mr. Speaker.
Senator Haji.
Thank you very much, Mr. Speaker, sir. Mr. Speaker, sir, before I go straight to the question, I just want to state that as a senator of Garissa, I am very happy and proud when I hear senators like Cherargei and Cheriot and Senator Sifuna praise the CS of Health, who happens to hail from Garissa. Senator Sifuna, you did say that he answered your question. No, you said he answered your question and you were very happy with his answer. So as a senator of Garissa, we're very happy and we're very proud of our son who hails from Garissa and he's got a very busy ministry and is doing a good job, and we want to wish him all the best. Mr. Speaker, sir, since regional cancer centers were established, they've been supported by the Ministry of Health through the supply of essential oncology drugs, which covered over 24 treatment regimens, including those for breast and prostate cancer. Over the past 1 year, we've seen a significant reduction in the supply of these oncology drugs. I would like to ask the CS to clarify whether if there has been any policy shift regarding the provision of cancer treatment drugs from the national government to the regional cancer centers, and how such changes affect facilities in marginalized regions such as Garissa County. Thank you, Mr. Speaker.
Senator Eddie Okech.
Thank you, Mr. Speaker. On the question by Senator Muma, Mr. Speaker, I didn't find it satisfactory. I've read the response here. Waziri, the question was, Mr. Speaker, when will the discriminatory age restriction be removed so as to allow adults with hearing impairments to access hearing aids under the SHE assistive device benefit package? Mr. Speaker, if you look at the response, I have no sense of idea of what timeline has been given by the CS. And with regards to that timeline, we need just to be very clear to be able to actually track that timeline, so that as Parliament we can actually be able to hold the ministry account to a timeline. So could the minister give us a timeline, not the narrative that is here? That
Honorable CS, you may respond.
Honorable Speaker, let me start with the last question. If Honorable Senator Eddie Okech read my statement, it's not a narrative. It's giving very clear direction. And I think Honorable Senator for Nairobi question is, because I have said we are looking at the whole issue. There's an element of taxation which we want to sort it out in this finance bill of this year. There is an element of we don't have specialists, but the element of the benefit package, which you have, I'm sure you are interested in when, is that we are looking at the current package, and that is under the Package and Tariff Advisory Committee, which we have submitted. It's an independent body that looks at many, including the one of cancer from 550 to 800. So, Senator, we will give you timeline. Once if tomorrow or the day after or next month the tariff package based at the University of Nairobi, if they give us, and they do public participation, they talk to the patient, they talk to stakeholders. Honorable Senator for Nairobi, I did not, the global percentage is about between 6 and 7%. And I suspect the same for Kenya. So 6% of the Kenyan population fall within this category. And I will give more detailed once I go back to the office and get the division. But I think it's about 6%. 6% comes to over 60 million, for example, if we say it's about 10 million Kenyans who are close to it, who are under this. Senator Duale, yes, all our benefits for all is on the website of SHA. And all hospitals, both private, public, and faith-based, they use that. And it differs even within surgery. And I'm very happy to thank you for taking that patient to Tenwek. Tenwek is a place, I have never been there. I mean, I used to hear, I went there. And in a day they do close to about, I think, 10 to 15 cardiovascular surgery, open heart surgery. Some of the best surgeons are there. And I really want to ask even the House that it might be very far, and it might be in rural Kenya. But that facility, if you are in Bomet or that area, please visit. So I will, if you give me the name of that patient, I will look at it. But that patient is right, and I'm sure SHA does not pay everything. Maybe on that particular benefit, it's 500,000. But if you send me the name of the patient, I can ask the leadership of SHA if there's something that we can do. But Senator Sifuna, also 2.2% of Kenyans also have the same form of disability. Approximately 1 million persons, according to the last population census. Senator Abdul, but before I come to Senator Abdul, my sister, Senator Foisiolo, maybe we'll also look at the surgical package of that patient. Because there are different surgical packages that the tariff is the same, and it's the same for all hospitals, both private, public, and faith-based. Kenyatta the same will charge what Tenwek will charge, what Nairobi Hospital will charge, what Aga Khan will charge. My senator, thank you very much. At least I have not let you down. I am also proud of my senator. But yes, the Regional Cancer Center, at least in Garissa, with the help of the governor, and the same for, we are now doing with the governor for Nakuru, for the Regional Cancer Center, and the one in Mombasa. And Honorable Speaker, we are also building a cancer center in Meru for that region, and also in Nyeri, so that we have a lot of cancer. But the one in Garissa, number one, what we have done is we isolated it from the main hospital, and now it has its own SHA account. Before it was put together with the county referral hospital. So we've agreed with the governor and the leadership, now it's on its own account. So all the patients, and it serves about 10 counties, from Isiolo, Marsabit, Mandera, Wajir, Tana River, Lamu, Kitui. So it's a very busy place. I will even maybe, Senator, you need to help me that we need to, there was some hostels, wards, which were started. We need to finish the wards because the patients who come from far, they have a problem of accommodation, and it's a bit expensive for them. So what we agreed with these 3 regional centers, including Garissa, is that they buy the consumables, and then the Ministry of Health will take care of the servicing of the equipment. Because the biggest problem was the infrastructure. The machines were broken down very often as the patients are on the line. It happened in Kenyatta, now we have rectified. So Garissa Regional Cancer Center, Nakuru Regional Cancer Center, and Mombasa Regional Cancer Center, the Ministry of Health, using the tobacco fund, which is related to the upsurge of cancer as part of it, we are now paying for the service level agreement so that the machines are serviced, and it's a very expensive exercise. It's costing us close to about 200 million for those 3 counties. So I think I will talk to the people in Garissa and ask them why they are not buying the consumables. I think they should buy it's on their part. Maybe you'll help me talk to the governor. And these 3 centers, Honorable Speaker, I think just to give as I said, 44,000 Kenyans are infected, cancer is affecting them in a year. So we have made a deliberate move that we build another 4 cancer centers, one in Kisii, one in Nyeri, one in Meru, and one in Kisumu. And I really want to seek the support of the House to help me sensitize screening for cancer. We need to talk to our people. Early detection, early screening is very important. Most of them are detected when they are at a very advanced level. And many cancers can be treated if they are detected at a very early stage, Honorable Speaker. So Garissa, we are working, and I think I'll also follow up what the Senator has raised once I leave here, just like the way I'll do for Mombasa and KNH and MTRH and all the other cancer centers, both public, private, and faith-based.
Honorable Senators, looking at the time, we are 50 minutes behind the schedule because there is time allocation for every question. I know we have 1 question left for the CS to respond to by Senator Minda Kibwana. So I have several requests here which I suggest because they are actually on SHA, and we left that question. After the CS finishes the question by Senator Minda Kibwana, I'll give the Senators Modama, my good friend Senator Kongo Mugeni, Senator Miraji, to ask those questions. A few minutes after he answers the question, responds to the question by Senator Aminda Kibwana. So Senator Aminda Kibwana asks question number 048.
Thank you, Mr. Speaker. Mr. Speaker, first I would also want to commend Bwana Waziri for tabling that report, for the job well done. It shows dedication, hard work, and he's actually equal to the task. And I'm very sure very soon we'll be calling him Dr. Duale with the expertise. My questions on 048, Mr. Speaker, is on Bwana Waziri, could you state the measures in place to operationalize the Kenya climate change and health strategy across national referral facilities and county health systems? Question B, what steps has the ministry taken to ensure that hospitals, clinics, laboratories, medicine supply chains, and emergency public health services remain functional during flooding, heat events, disease outbreaks, and other climate-related shocks? Question C, could the Cabinet Secretary state whether the ministry has conducted a national assessment of the vulnerable of health facilities and public health systems to flooding, extreme heat, vector-borne diseases, water contamination, and power disruption, and if so, what were the findings? The last one, what budgetary policy and infrastructure measures in the ministry adopting to strengthen climate health preparedness in line with practices used in countries that have integrated climate resilience into health planning, such as Bangladesh and the Netherlands? I thank you, Mr. Speaker.
OCS, proceed.
Honorable Speaker, the question by Senator Hamida is very, very important, not only to the Ministry of Health, but to the government and the people of Kenya. And that I want to confirm that we are operationalizing the Kenya Climate Change and Health Strategy 2024-2029 through very key measures and deliberate efforts. The first one is we are strengthening our institutions. A dedicated climate change and health unit has been established to coordinate implementation across the national referral facilities and county health system. And this is to ensure that we have a coherent policy and integration. Two, on vulnerability assessment, the Kenya Climate Change and Health Vulnerability and Adaptation Assessment has been initiated. Phase 2 has been completed by 31st of March 2026 with all the county level vulnerability profiles. All the ASAL and coast regions have been identified as high-risk areas. Phase 2 will form a costed health national adaptation plan. And the last one is climate resilient health guidelines. We have partnered support, and the ministry has developed what we call green health guidelines. We have also done the resilient health facility guidelines, which are available. What does these guidelines do? These guidelines provide a framework for climate resilient infrastructure, on sustainable waste management, and how do we deliver a very resilient health service across our country. On coordination platform, the Kenya Green Health Platform is being established within the next 3 months, and is supposed to coordinate implementation, supposed to track progress, and is supposed to strengthen accountability across national and county levels. On air quality and climate health intervention, the key actions that we did include the development of a household air pollution strategy, the training manual for our community health promoters, the 107,000, and this will help the community health promoters to strengthen the community level awareness and intervention. We are also establishing the Kenya Air Pollution Center of Excellence at Kemri soon, And as Kenya is a member and co-chair of the WHO-led Friends of Clean Air for Health initiative, this positions our country as a global leader in advancing clean air as a public health imperative. Honorable Speaker and members, our ministry is also strengthening the implementation of the Kenya climate change and health strategy through coordination with other institutions, making sure that we have evidence-based planning, making sure that we have resilient infrastructure standards that can withstand these shocks, and we have targeted air quality interventions. All these measures, I have said, will help our country prepare and the resilience of both at the national and the county level health system against any climate-related health risk. On what steps the ministry has taken to ensure hospitals, clinics, and laboratories and medical supply chains and emergency health public services remain functional. The Ministry of Health has instituted the following measures to ensure continuity of health services during the climate-related shocks. First is how we build resilient infrastructure. Implementation of resilient health facility guidelines to strengthen facility safety, particularly in high-risk areas. So we have mapped out all our facilities across the country, particularly in high-risk areas, to make sure that they have a very resilient infrastructure. Then, of course, we have, which is our core mandate, emergency preparedness. We have both strengthened the national and the county response system, making sure that we preposition enough supplies, we create a very rapid response teams, and we do emergency operation centers, working with colleagues in other critical departments. On supply chain continuity, that's why we said KEMSA now is fully recapitalized, so maintenance of buffer stocks, diversified sourcing, and improved logistics to ensure we are even introducing drones in terms of delivering items like blood during bad weather in some parts of our country. We are doing also surveillance and early warning, enhanced disease surveillance systems, detection and response to climate-sensitive outbreaks, the Rift Valley fever, and many, many others. Laboratory capacity, yes, working with the partners, including the US and other WHO, we have strengthened our laboratory networks and our referral system. Today, I want to confirm to the country that the samples we used to send to the US CDC and South Africa is no longer. We do a lot of our testing and samples both at Kenyatta and the Cambridge labs. Workforce capacity, we are training a lot of healthcare workers and community health promoters on how they can respond to emergencies and risk communications. Honorable Speaker, on the question of could the Cabinet Secretary state whether the ministry has conducted national assessment? Yes, we have undertaken a national assessment of the vulnerability of health facilities and public health systems through what we call the Kenya Climate Change and Health Vulnerability and Adaptation Assessment, and this is in line with the Kenya Climate Change and Health Strategy 2024-2029. Of course, I have said the phase 1 is completed. We completed by 31st of March 2026, and that phase 1 provides a very comprehensive county level analysis of climate-related health risk and system. And what did we find out? We had very interesting findings. Geographical vulnerability. We found out that the arid and semi-arid areas and the coastal region were identified as the most vulnerable, with heightened exposure to drought, flooding, and extreme heat. We have also found out from this study that health facility infrastructure risk, a significant proportion of health facilities in the high-risk areas were found to be susceptible to flooding, inadequate drainage, heat stress, lack of power supply, And all this is affecting the continuity and provision of health care. We have also found out the disease burden patterns. In this assessment, we have confirmed that there's increased risk of climate-sensitive diseases. These include vector-borne diseases, malaria, waterborne diseases, which are linked to flooding and contamination and heat-related. So we also found the water and the sanitation and hygiene challenges, gaps were identified. We also identified gaps in the supply chain and service disruption. We also found out that laboratory and surveillance capacity gaps. Honorable Speaker and members, the ongoing phase 2 of this now will give us an opportunity and provide a more detailed and comprehensive national analysis. And its findings will form the development of a more costed. We want to put numbers to what we have seen. For the people at the Treasury and our partners to see. And this outlining very targeted intervention so that we streamline the resilience of health facilities and the systems. On the last question, what budgetary policy and infrastructure measures is the ministry putting to strengthen this climate health preparedness? Let me speak for the Ministry of Health because it is a multi-sector. Our ministry is, the Ministry of Health is strengthening the climate health preparedness through a very deliberate targeted budget, policy and infrastructure measures. And these are informed by the international best practice, including lessons that we have learned from Bangladesh and Netherlands. On budget, I think there is an integration of climate health priorities into our medium-term expenditure framework and annual budgets with the allocations. And I have just sent a letter to the Minister for Finance yesterday asking for budget on this issue. I hope in his wisdom under the tight physical space, he will consider and Parliament will consider when they are dealing with the annual estimates that will be tabled maybe next week. On policy and regulatory measures, operationalization of the Kenya Climate Change and Health Strategy 2024-2029 are all aligned with our national climate framework, and they are supported by what I earlier said, the green health and resilient health facilities. On infrastructure and system strengthening, we are retrofitting and upgrading health facilities for resilience to flood and advising our county governments and other private sector players, faith-based, they must build facilities that are resilient to floods, to heat, and power disruption. We are telling them and we are making sure that we promote sustainable energy solutions, and we also strengthen WASH systems and provide digital surveillance platforms. Finally, on capacity building, I think the healthcare workers are being trained, expansion on climate health research and establishment. These are areas I think they're very important, and I'm very happy, Honorable Speaker, that Senator Hamida has raised it. It's a very important area that has been neglected and was affecting us during floods, during drought, during heat waves. You see hospitals being submerged, outbreak of diseases which are related to the climate shocks. And finally, our multi-sectoral collaboration, we want to enhance the coordination with the government sectors and partners to support the integrated climate health response. Thank you, Mr. Speaker.
Mida Kibwana, do you have any supplementary question?
Bwana Speaker, I just want to add from the response from Waziri Asante for your response. I was just wondering if there are any, so far, are you assisting counties to mainstream this strategy so that at least they can have their own strategies and assessing and concluding this as you have tabled? And also, are you leveraging on also any kind of support, external partnerships? I'm sure there are countries that would want to partner on such, mainstreaming. So at least for the counties also to implement, their own, and then also just have partnerships whom you can leverage on. Thank you.
Honorable Waziri.
Yes, Honorable Speaker, thank you, and Honorable Senators. If you look at page 22 on phase 1, which we have just completed, 31st March 2026, we are completely aligned with the county level vulnerability profiles. That's how we picked ASAL, Coast. So based on that report, which we have shared with the counties, and everything we do, health is devolved. So as environment, most of it is devolved. So we're working with them, but I'm sure phase 2 is where now we want to inform a more costed national health national adaptation plan, so that the counties can plan in terms of how much resources they will inject. And then finally, I agree with you, there are many partners, many organizations who are ready to partner with us. And what we have done now in the Ministry of Health is that we have introduced a system where it is one budget, one plan, one budget, and one M&E. So donors don't just come and they don't go to a county and they start something which already. So we sit with the donors, with the counties, and we say, this area has been funded by government, this area has been funded by this donor, we have a gap here, can you please help? So we will talk to our partners, both at the UN level and at the other international level. Many of them are ready to support us.
I have several requests here. Now, there are the same members I mentioned. I will give an opportunity at the tail end of this discussion. So, Senator Mudama.
Thank you, Mr. Speaker, for this opportunity. And I just want to, first of all, thank the CS for coming, because many of the times we call CSs and they don't appear. So thank you, Bwana CS, for coming. I have a question about a patient who was admitted at KU Referral Hospital, and he died a month ago. SHA paid 1,200. Well, the bill was 1.202, and SHA paid 400. The balance of the bill was 800. Bwana CS, this man has only 3 daughters, and they are not working. They fundraised on the 13th of this month, and they raised 150. I was wondering, Bwana CS, at your capacity, what can you do, and is it legal for a dead person to be retained in a hospital because of non-payments, or they can come into agreements? The children of the deceased has already gone to the chief. The chief has written letters to the hospital. So, Bwana CS, I was wondering how you can assist for this body to be buried. Thank you, Mr. Speaker.
Before you get a response from the CS, I really wanted to know which other member has a supplementary question on the primary question first. You know, this is a technical area on climate change and health strategy. It's a technical area. The CS is lucky that he served in the Ministry of Environment, and that is why he's able now to understand what Senator Minda wants to know. So, Senator Nyutu, Joe Nyutu.
Thank you, Honorable Speaker. My question to the CS is based on Part B of the question that Senator Hamida Kibwana asked on the steps that the ministry is taking to ensure that clinics, laboratories, and medical supply chains serve or are available to these institutions, public health, medical facilities during when we have disease outbreaks from climate change, Mr. Speaker. But then, you know, Mr. Speaker, we also have a big referral hospital in this city by the name Kenyatta National Hospital. And there have been reports, Mr. Speaker, that sometimes supplies, even laboratory supplies, medicine supplies, are not available, which has been resulting from the fact that the government is collecting all the payments there through the e-citizen platform. So, Mr. Speaker, my question to the CS is, what informed this decision to have monies payable to Kenyatta National Hospital collected through e-citizen, which then means that the hospital cannot access those funds directly? And Mr. Speaker, you know, hospitals are doing very well in the counties when they collect these monies for themselves and they use it for what we are calling facility improvement fund. So exactly what informed this, and what guarantee do we have, Honorable CS, that Kenyatta National Hospital will continue having medical supplies and laboratory supplies in spite of the fact that the hospital does not collect this money directly because it is collected through an e-citizen platform? Mr. Speaker, that is my question. Thank you very much.
Senator Junyutu, you know you are a bit crafty. You are touching on climate change and then diving again to Kenyatta National Hospital. Yeah? So that is why I'm asking any member, if there is no other member on climate change issues, then let's get another question from Senator Okongo Mugen.
Yes, Mr. Speaker, mine is a supplementary question to the answer that was given by the CS. And I first want to thank his ministry and the CEO of SHA, because they made an intervention for a patient. I think that was last week, who was being asked to pay an advance payment of 45,000 shillings in a private hospital in Kisii before accessing dialysis. And I think that was an attempt by the hospital to extort money from a patient who is fully covered by SHA. Now, Mr. Speaker, sir, the CS has emphasized that it is important for Kenyans to go through cancer screening. And I just wanted to get the thoughts of the minister, how he can assist the, the very vulnerable Kenyans who are supposed to get these services from our county referral hospitals, yet those hospitals don't have the facilities to do cancer screening. I can give an example of my own county of Nyamira. We don't have MRI machines. We don't have facilities that can allow patients to go through intestinal cancer screening. I think what they call endoscopy. If you go to a private hospital like Nairobi, I think they charge about 37,500 just for the facilities alone. The doctor will charge another 55,000 shillings. Yet at the counties, Mr. Speaker, I don't know about your county of Meru, but most of our counties don't have these facilities. In fact, in Nyamira, we don't have an oncologist. We don't have an MRI. We don't have a radiologist. So even if we urge Kenyans to go for screening, the only fallback is to go to our private hospitals. In that region, there is only one private hospital, Oasis, that can allow patients to go through screening. So my question is, can SHA, the SHA card, especially Kenyans who pay 500 shillings, can they enjoy this service of early cancer screening in our private hospitals using the SHA cover? Because the facilities are not in our public hospitals. And Waziri, I'm willing to visit with you my county hospital of Nyamira, or you can make reference to the auditor's report, financial year 2024-25. He has highlighted that all these specialists have not been employed by our county government of Nyamira, plus all the 3 other level 4 hospitals. That is the situation. So I want to know whether that service can be available to the people I represent to get the cancer screening. Thank you, Mr. Speaker.
Okay, last but not the least, Senator Miraj Abdulilai.
Asante Mheshimiwa Spika. Swali langu kwa waziri ilikuwa ni kumuuliza kuhusiana na masuala ya malipo ya SHA katika hospitali zetu kuu za referral, hususan ile yetu ya Pwani. Lakini katika changizo zake nimemsikia amesema ya kwamba tayari wametayarisha malipo hayo. Kwa hivyo yangu ni pongezi, mwambia ya kwamba sisi kama Wapwani tunaitegemea sana hospitali ile, na tumefurahia pia kusikia ya kwamba kuna facility ya kansa inaendelea kujengwa pale ndani. Asante Bwana Spika.
Kanuni ninazotumia hapa haziruhusu wewe utoe shukrani saa kama hizi, ni maswali tu ya ziada. Lakini ni vyema, wengi wameshukuru waziri na sina bundi na mimi pia kusema anafanya kazi jema. So there are three just supplementary questions from Senator Kongo Mgeni and Senator Kibwana and Senator Njonyu. If you do that in 1-2 minutes, we'll be concluding with you, Waziri. Thank you.
Honorable Speaker, I will be very fast. Honorable Senator for Machakos, Senator Mudama, I really understand your case. SHA has paid 400,000. That is all they could pay as per the benefits of the patient. Now the patient has 800,000. From my experience, even now as a leader and when I was in Parliament, there are some bit you have to pay yourself. We have to do a rambe for that 800. Me, you, and many others. So, no, you have said only the family has 800. So what you do, send me the list. Please see how much we can raise. And then I will see how much the hospital can waive. And I will deal with that matter. It's very urgent. We don't want to keep bodies. It's against, it's immoral, it's unconstitutional. And I will do, but we should also protect our hospital. But that one, I'll deal with it. And there's a certain threshold that we can ask KU to RH to waive. Two, my good friend Senator Newtu, I want you to go to Kenyatta Hospital today. Just yesterday alone, Kenyatta Hospital was paid 531 million by SHA. It was number one. For many reasons. One, it has a high number of patients. And two, there is a new good leadership. We have removed all the corrupt ones. And the board led by Abbas Gulet, former Kenya Red Cross chair, and the Siampe who was before in Kenyatta, and now they are doing extremely work. 11 wards are being refurbished. Even their money, the little that goes through e-citizen platform, they get it. So what you read in social media is fabrication. In fact, I'll be going to launch another section of Kenyatta. I'll look for you. So Kenyatta is not the Kenyatta of the yesterday. And I really want to tell the country, both the private wing, and in fact the private premier wing of Kenyatta now is being used by our leaders. So Kenyatta is doing well. It has enough money, and e-citizen has transformed our country. Senator, e-citizen has transformed our country. You might not like the president who introduced it or the government introduced it, but while you are sitting here, you can use e-citizen platform to sort out many personal community issues and payment. And you do payment here, Kenya Power, whatever, anything, KRA. So I think it has challenges. The way even, I'm not saying SHA is 100%, we have some operational challenges. The way M-Pesa sometimes is in a kwama, but I can tell you Kenyatta, and I'm ready to take you there. The supplies are there. They buy from KEMSA. Where they don't find KEMSA, they buy from the private sector. In fact, by next week, we are putting the 4th linear machine for our cancer patients. They serve 150. We want them to serve 300, 400. Kenyatta University is a premier. It serves Murang'a, Kiambu, Machakos, the whole of that region. But Kenyatta Hospital is doing very well. I think there was a question from Senator Omogeni. Senator, I want you to listen to me. I didn't want to say this, but I have to say, healthcare in Nyamira has collapsed. And it has collapsed because of your governor. I want to be very honest with you. There are about 3 counties where healthcare is collapsed. Let me give you a very good example. All the things you have said, all the equipment you have said, are provided for under the National Equipment Support Program. I was in Bungoma, his counterpart. There is a radiology, there is a mammograph, there is dialysis machine, there is even a CT scan we have launched, all under this program. And he is not putting a coin. The national government is not putting a coin. It is fee for service. Every patient who uses it is paid for by SHA. Your governor and Nyamira, he has signed for the next program, but he's unable to make a request. He's unable to make a request, and I cannot force him. So if he make a request today, by next week, me and you will go and launch CT scan. We'll go and launch all these equipments. But I can tell, and it's good, I think I need to be very honest to Kenya and to the residents of Nyamira, that I think it is morally wrong, it is religiously wrong for you to be a leader and to be a governor of Nyamira, and you allow the most critical sector to collapse because of leadership. I didn't want to say this, but I have to say it. Even the primary health care, which is free, level 2, level 3, the dispensaries and the health centers, it is free. Government is paying for. And if you look at the money, if he does well in health and put the equipment, even the revenue of Nyamira County from the health sector will be the highest. I'll give you a good example. Senator Miraj asked me, Coast General Hospital, yesterday we paid them over 235 million. I have the chief finance officer of Shahia. I think it's about, it was number like 6. Nakuru General Referral Hospital. There are counties that have received close to 8 billion since SHA started 18 months ago. It depends on leaders. But because today the senator, a good friend of mine and a very progressive senator, even look at that 45K of dialysis. It's not even the price. Dialysis, the 2 sessions are fully covered by SHA. No Kenyan should be charged as long as he is a member of SHIF. Every Kenyan who goes for dialysis, 2 sessions, they are fully covered by SHA. There are few Kenyans who go for 3rd session. We are trying to look at the benefit package and maybe get it from another package. And maybe by the end of the year, we will make sure that all the dialysis package are covered. I have just said Nyamira is next to Kisii and Bungoma and Mandera. The private hospitals there are part of the fraud that is going in Nakate. Thank you, Mr. Speaker.
Okay. Thank you, CS, for your time to appear before the Senate. So, as you have heard clearly from the Senate, they are happy with your work, continue doing this and good work with your team. So I want to release you to go and serve other Kenyans. So Waziri, I have released you. Now we are happy that you have been able to handle the questions nicely, because you have taken a lot of them, because you understand the subject matter of whatever is happening there. So thank you very much indeed, and all the best. So we have the next CS, the CS for Interior, National Security. So I request the Sergeant at Arms to usher in the CS. I want to take this opportunity to welcome the CS for National Security, Interior and National Administration to the Senate. You are citizen, the friend of the Senate. So we have several questions, honorable senators. We really must manage our time. We have 11 questions, and then to do within, this is 53 minutes. So Senator Manzo, I want you to start with the first question.
Yes, Mr. Speaker, this is
Just a
question.
minute, because you have several questions. I want to see where we are starting. Question number 015.
Yes. Thank you, Mr. Speaker. Mr. Speaker, 015. A, could the Cabinet Secretary explain the circumstances surrounding the abduction and subsequent death of Mr. Emmanuel Mumo Divo, a resident of Lukenya Village, Masongalen Ward, Kibwezi East constituency, who was last seen alive on the night of 24th August 2025 in Nairobi. B, were the police at any point involved in the detention, custody, or handling of the late Mr. Ndivo between the time of his abduction and his eventual transfer to Nairobi City County Funeral Home? C, what official records or documentation exist regarding the circumstances under which the late Mr. Ndivo was found and taken to the mortuary, and why was his family not immediately informed by the relevant authorities? I thank you, Mr. Speaker.
Honorable CS, proceed and give your response.
Thank you, Mr. Speaker. Once again, I thank you, Mr. Speaker, for inviting me to come back to this august house to discuss these issues related to the security of our country. Considering the time given, and I do not pretend to advise the Speaker or the House, but Mr. Speaker, I have said this before, and allow me to repeat that it would be nice if you invite us with those many questions to just restrict it to one Cabinet Secretariat session, so that we do not rush all the questions at once, considering that how we schedule also our diaries is to take care of the serious business of the Senate. But be it as it may, I will abide by the calendar as has been provided. Mr. Speaker, on question 15, I will go straight to the answers because I don't have the time to repeat the question on part 1, which is regarding the circumstances surrounding the abduction and subsequent death of Mr. Emmanuel Mumo Ndivo. Mr. Speaker, the government is not aware of the abduction of Emmanuel Mumo Ndivo. On the contrary, the government is aware that on August 27th of August 2025, Mr. Jackson Kioko Ndivo reported the disappearance of his brother, Mr. Emmanuel Mumo Ndivo, aged 33 years, at Kangemi Police Station, Vaidanobi number 1827/8 of 2025. He alleged that Emmanuel had gone missing since 24th of August 2025 at about 1800 hours. On August 29th, 2025, DCI Dagoretti commenced investigations into the matter. Call data records was requested from the mobile subscriber, and the report was subsequently delivered to the Nairobi Regional Crime Headquarters via reference number 3265 of 2025. Before the investigation could progress further, Jackson reported at the DCI Dagoretti office that the body of Emmanuel had been found lifeless at the Nairobi Funeral Home, admitted via number 1487 of 2025, allegedly having been involved in a fatal road traffic accident along Wayaki Way. Dagoretti Base Command addressed the issue
and our preliminary investigations revealed that a report of a hit-and-run fatal road accident was filed at Kabete Police Station on August 25th, 2025, under OB number 25/24 of August 2025 at around 9:30 hours. It was reported that an unknown male body was lying in the middle of the road along Wayaki Way. Crime scene personnel visited and processed the scene, and upon examination, the body showed injuries consistent with the traffic accident. The body was removed to Nairobi Funeral Home by police officers from Kabete Police Station for preservation, pending identification and post-mortem. The base commander, Dakoreti, later on the same day circulated the same through a signal via Kabete Police Station OB number 2425/08 of 2025. On 9th September 2025, the Dakoreti base commander, through Corporal Mwanzia of Nairobi Funeral Morgue, supervised the post-mortem, which was conducted by Dr. Maingi, pathologist, and witnessed by brothers of the deceased, Mutua Ndivo, Francis Ndivo Kaesa, and Jackson Kioko Ndivo. The pathologist opined the cause of death as blunt head, chest, and abdominal organ injuries consistent with the road traffic accident. On whether the police were at any point involved in the detention, custody, or handling of the late Mr. Ndivo. Mr. Speaker, let me just say that at this point, it's becoming, there is a rampant behavior where even professionals at the level of lawyers and other educated Kenyans, when someone is arrested, they say he was abducted. Or when somebody is missing, they say he was abducted. Abduction is a technical legal term that denotes a particular action that has been done, not when someone is missing. When someone is missing, Mr. Speaker, there could be many reasons. Either he's hiding, or he has he's died, or he has been abducted, as may be the case. But to start a question by saying, answer the abduction of so-and-so is, Mr. Speaker, very erroneous. And it's becoming the norm now that anybody who is lost, or even when police arrest somebody, they say the police abducted. Police cannot abduct people when they are arresting them to take them to police station. Now, part B of the question on whether the police were at any point involved in the detention, custody, or handling of the late Mr. Ndivo. Honorable Speaker, from police records, there is no report indicating the abduction and detention of the late Emmanuel. However, there exists a report of a fatal road traffic accident. However, police officers from Kabete Police Station attended the scene of the accident and moved the body to a known person to Nairobi Funeral Home for preservation. The body was later identified by the family. Concerning the existence of records of documentation regarding the circumstance under which the late Ndivo was reportedly found and taken to the mortuary, and why his family was not immediately informed by the relevant authorities, Honorable Speaker, within the police custody, there exists records on: 1, hit-and-run traffic road accident report at Kabete Police Station; 2, circulation of base commander Dakoreti through a signal via Kabete Polill Station on the 25th 8 of 2025, OB number 2425/08225, 2025. Nairobi City County Funeral Home mock admission of an unknown body under admission number 1487/2085. Report of a missing person made at Kangemi Police Station by 1 Jackson Kioko Ndivo on 27th of August 2025. According to police records, all necessary procedures relating to a hit-and-run fatal traffic accident were duly undertaken as outlined above. The family was not immediately informed since the incident involved an unidentified body from a hit-and-run case, necessitating the identification process, which was eventually conducted by the family. So, in other words, it was not possible for the police to inform the family because there were no records to show the family of the deceased. Number D, on measures put in place by the National Police Service to ensure accountability in case of alleged enforced disappearance and prevention of further incidents. Honorable Speaker, the government remains firmly committed to upholding the Constitution of Kenya and safeguarding the fundamental rights and freedoms of all citizens. The government refutes claims of enforced disappearance, which is not sanctioned activity of the state. Such acts are criminal in nature and perpetrated by individuals or organized criminal elements acting outside the law. To mitigate and respond to incidents of abduction and to enhance public safety, the following proactive measures have been employed. 1, a dedicated response team domiciled at the DCI headquarters was formed to swiftly handle cases of abduction. 2, the police conduct or alleged cases of abduction. 2, the police conduct investigation to all reported cases, ensuring prompt arraignment in court of law for those found culpable culpable to deter future criminal activities. 3, members of the public to be sensitized to share information within the police through Fichua kwa DCI, toll-free number 08722003 and WhatsApp number 0709570000, ensuring confidentiality in reporting of crimes and safety of the whistleblowers. 4, reactivating inactive community police committee to improve collaboration between the police and the community, fostering information and sharing and early identification of security threats, strengthening both foot and mobile patrols to prevent crime while reinforcing police visibility in key areas such as residential neighborhoods, marketplaces, and transport hubs. Let me conclude by saying, Mr. Speaker, that unfortunately there are also rising cases of self-abduction or staged abduction, and it is embarrassing that it's done by leaders who serve in such high offices, including members of parliament, former ministers, and so forth and so forth. And this culture of self-abduction or staged abduction is negatively impacting serious cases of abduction or enforced disappearance or missing persons, because people are using abductions for political gain. I thank you, Mr. Speaker.
Senator Manzo, do you have any supplementary question?
Yeah, Mr. Speaker, with your kind permission, because I've got 2 related questions, if I could kindly abandon the first one.
Senators, we are really constrained by time.
If I could just go to the next one with your kind permission, Speaker.
And I will not take any question not related to the question, the primary question. Yeah. Senator Manzo?
Yeah, with your permission, let me proceed with the number 16.
Oh, you have no supplementary question?
Numbers, no, I'm on the next
on
one.
015?
No, but to save time, to go to 016 because they are related.
But the other senators who need something on the same question that you have asked.
Okay, much
okay. Senator Haji Abdul.
Thank you, Mr. Speaker. Mr. Speaker, as you're aware, police brutality has become a matter of growing national concern, particularly in marginalized areas where public confidence in law enforcement continues to erode. Mr. Speaker, yesterday there was a bit of an unrest in Garissa County. A young man, 24-year-old taxi driver Aden Mohammed, was arrested, handcuffed, and then shot by a police officer named Charles Kaui, who is a DCI driver based in Garissa Police Station. Mr. Speaker, sir, I would like the Minister, the CS, to inform this House on the status of the investigation, if any have taken place, because it's to my understanding, Charles Kaui, who is the DCI driver, who is alleged to have committed the shooting, is at large and on the run. Could the CS inform us if he has been arrested or his whereabouts has been detected? And the shooting happened at the checkpoint of Modika Barak Junction corridor. Could also the CS inform us on the need for so many checkpoints on that road, and whether, if those checkpoints are lawfully gazetted, and what action has been taken against any that are found to be illegal, irregular, or operating outside the law? Thank you, Mr. Speaker.
Honorable Senator, as you know, that's why I say let us really stick to the primary question. I don't know now whether the CS has a report on yesterday's occurrence, but Honorable CS, just try and see whether you can answer Senator Haji, then I will do another round. Yes, no problem. We are still there.
Thank you, Mr. Speaker. Mr. Speaker, actually, without overruling you, I need your attention, Mr. Speaker. Yes, without overruling you, Mr. Speaker, the question number 15 and 16, in any way, without challenging your authority, the question number 15 and 16, to agree with Senator Manzo, is exactly the same. The next one is about missing persons, the 16. So that if there were going to be clarifications, it would have been good to combine 15 and 16 so that the clarifications related to missing persons can be the same, in my own opinion, so that any responses on that issue, because the question 16 has statistics of disappearance or missing persons and so forth. But let me just capture the issue of the Senator of Garissa. The question related to yesterday's unfortunate incident where a police officer, I think called Charles Nguni, was actually attacked and killed a civilian in a roadblock. Is unfortunate. The report I have now, Mr. Speaker, is that that particular police officer is on the run. The DCI officers within the county are chasing after him. We believe that he should be arrested any time from now. More importantly, IPOA has been invited to take the proper legal steps and being assisted by the officers from DCI. As soon as the suspect arrested, we will take him, working together with IPOA. He will be taken to court and the processes will follow. These cases, Mr. Speaker, of police brutality are taken very serious by National Police Service, investigated. But I must say that as a ministry, we have been advocating for better budget for IPOA because they are grossly underfunded and making it difficult for them to carry out their responsibilities of oversighting and holding into account police officers who are found in such cases as the case in Garissa. I promise the Senator that I will be on this case, on the case of the IG, to ensure that there is accountability on the part of the National Police Service on this particular matter. I thank you.
Senator Mudigi.
Okay, asante Bwana Spika. Swali langu kwa waziri, tunaona ile kazi unafanya kazi ngumu na imeleta shida katika Kenya. Swali langu Bwana waziri, Embu County huko Mbere North pahali inaitwa ward inaitwa Evrole Ward. Tarehe 14 mwezi hii watu wa huko walikuwa demonstrating juu ya shida ya hospitali, lakini kwa bahati mzuri ama bahati mbaya wakiwa na, unajua sheria inasema mtu anaweza kudemonstrate na huko na uhuru, kulitokea shinda. Kijana mmoja anaitwa Morris Njue Njoka, Patrick Karioki Munene, askari alitupa funduki akaua vijana wawili. Bwana waziri, kila wakati wote kukitokea mambo ya maandamano, askari wamekuwa na shida hizi, na ninajua hakuna mtu anaweza kusema atienda ukandemonstrate alafu askari akuja uwe, hakuna kitu kama hiyo. Swali langu Bwana waziri.
Senator Mudigi, naomba ulize swali moja.
Swali langu Bwana waziri. Okay, asante Bwana Spika. Swali langu Bwana waziri, ni njia gani mpaka leo kwa hiyo masiku umechukua ndio watu wa Embu County wanjue ukweli wa huyu askari ameshikwa ama anjeshikwa, ama kuna njia yoyote unaweza kutumia kitendo kama hiki kitiwe inaweza kuonekana wakati mwingine kuwe na kila sub county ama county kuwe na watu wa kufunza askari, ndio kusiwe kunatokea mambo kama hii, mambo ya dialogue na mambo ya watu, kwa sababu askari wamekuwa akifanya vitu kama hii na inaleta shida katika nchi yetu ya Kenya na inaharibu jina ya serikali. Asanti Bwana Spika.
Senator Newton, and please be precise to your question.
Yes, I will be, Mr. Speaker, and thank you for this opportunity. I just want to, before I ask my question, to notify the CS, that abductions are done by the police and not criminals. Criminals would ordinarily kidnap victims for monetary gain. So my question to the CS is. Exactly, does it worry you, Honorable CS, when you find police officers in uniform, hooded, meaning they are hiding their faces, while arresting or doing whatever it is that they do, because they are always hooded? What is the place of hoods in the police force? Because, Mr. Speaker, a police officer, if they are doing things that are lawful, they should not be hooded. So my question is, why do officers continue operating while wearing hoods? Because that is when they perpetrate criminality. Thank you, Mr. Speaker.
Senator Okech.
Mr. Speaker, I really need your attention on this, because it seems like the previous speaker who has just left the seat of the chair, Mr. Speaker, did not get what the CS said. Mr. Speaker, on this issue of abduction, the CS expressly said that there is an ongoing element of self-abduction. In his response, there is an ongoing element of self-abduction by senior members of this society, including some serious positions that have been in this country, Mr. Speaker, in the past. Now, Mr. Speaker, you know, this is a very important issue, Mr. Speaker. You know very well that this is House of Parliament. And as a serious issue as abductions that have been going on in the country, if there is an impairment of dealing with abduction because senior members of this society are doing self-abduction, and the CS comes to this house and expressly says so, he must substantiate, Mr. Speaker. He must give us fact of who are these senior members of the society that in his tone and texture he has indicated. Can he give us the name of these people who are doing self-abductions and making it difficult to deal with the issue of self-abduction in the country, Mr. Speaker? This is a House of Parliament. We cannot just let it go as if it was just a bypassing statement.
Thank you,
otherwise
Senator.
it becomes an impairment to justice.
Thank you for your question. Senator Veronica.
Thank you, Honorable Speaker. I wanted, first of all, to seek that same clarification on the abduction, because I was of the view that Senator John Nyoto is misleading after the CS has confirmed that the term abduction is specific and technical and has defined what abduction entails, and that when a Kenyan is being arrested, is not being abducted. If they are being arrested by police, it's not an abduction. But since Senator Eddy has raised it, I will not repeat it. I'll ask Honorable CS to explain to us, or to just give us information on what his office is doing regarding Kenyans who are tricked into accepting jobs in Russia, and it turned out they were being taken to the battlefront between Ukraine and Russia, and among those was James Mushoki Mwangi, whom the family cannot trace and has no connection with.
Senator Veronica,
Yes.
you're going way out of line. You should stick to the primary question. So, CS, please answer the supplementary questions, and then we'll go to the main questions.
Thank you, Mr. Speaker. A number of questions have been asked, but let me start by saying that the question of by Senator Mundiki on the police brutality in Everori in the Mbeere North, I must say that that was an unfortunate situation. Investigations are ongoing to establish exactly why. If Kenyans were having peaceful protests, how come and how did it end at a police station? And because we were told the protest was about health facilities, but instead the protesters apparently charged at the police officers within the police station. That is alleged. So investigation would establish whether the protest was peaceful, whether it targeted police station, and whether
the police officers who used their firearm, and which eventually killed 2 young people or 2 people, Mr. Speaker, whether it was a legitimate use of force or it was a misuse of firearm. Number 2 is that that investigation, to facilitate proper investigation, the Inspector General of Police, following the required procedures, has suspended those 2 officers. They are not in office as we speak, to allow proper investigations. Investigations also to ensure that the investigations are free, fair, and accountable. The Independent Police Oversight Authority, IPOA, is seized of the matter, and they are carrying out the investigations. And I repeat my earlier statement that we are working hard to facilitate process of empowering the IPOA so that they can have enough resources and investigators to carry out investigation expeditiously. Ballistic analysis is ongoing, forensic analysis of the information that will enable us to deal with this issue with finality. I condole with the families of the 2 men who were killed and pray that they may find justice. And I promise, as a Cabinet Secretary in this department, that we'll do everything to facilitate processes of accountability within the police service. The Senator Nyutu, I hasten to say that police officers are not in office to abduct people. Anybody who carries an abduction is a criminal. It doesn't matter whether he's a serving police officer or is in office or is a civilian or any other person. Any abductions that are done or enforced disappearance are illegal. Police officers are only allowed to arrest a citizen and produce them in court within 24 hours. Anything beyond 24 hours, again, is illegal because it's a violation of the Constitution. The Constitution requires that if you must hold a citizen beyond the 24 hours, it must be with the consent of the court. And so 24 hours is mandatory, and that is the right. Anything beyond that is unconstitutional. The hooding of police officers' uniform, includes hoods, are used in certain circumstances for operational reasons, especially when you need to protect the identity of the police officers when carrying out dangerous operations that deals with people like terrorists, sometimes bandits, sometimes gangs. Gangs are very targeting of police officers. And I am glad that the Senator appreciates that sometimes those gangs and criminals may be within demos or in public space or any places that can be, and the police officers are rightly to protect themselves and protect their identity so that they are not targeted by dangerous criminals after carrying out the responsibilities they do. But by law, once they do so, they arrest the person and they must produce them in court. You need to know that our police officers operating in serious areas like the border of Kenya and Somalia face dangers every day. And if you were to force them to be seen, or those who are operating in areas infested with bandits are always facing dangerous criminals who are ready to revenge. And hooding and protecting our police officers is the responsibility of the National Police Service to provide the necessary uniform. On the question of Senator Okech, in terms of self-abductions, I don't think Senator Okech has just come from Mars. He's not a stranger in Jerusalem. He was in town when the Honorable Koimburi abducted himself. And then there was a man, and the impeached deputy president went to the hospital. And then, you know, he was even lying to Kenyans that Koimburi cannot speak. You know, he was given chemicals and so forth. I am glad that the alleged victim then, Honorable Koimburi, has now laid bare that this was an act of drama, Mr. Speaker, that was only meant to win Kenyans. And up to now, the impeached deputy president has never has never apologized to the people of Kenya. He continues his lies. He progresses. So he's looking for another drama to try to paint the government National Police Service in bad light. Mr. Speaker, the same happened to Honorable Tuju the other day, self-abducted, ran around. Only, Mr. Speaker, to be found, he was in his bedroom, relaxing and sleeping there. The former deputy president, the former vice president, who was leading the charge to paint the government negatively, up to now has not apologized, despite the fact that Honorable Kalonzo Musyoka is my personal friend. I found that was a very embarrassing situation he found himself in, being part and parcel of a script, Mr. Speaker, that is painting self-abductions. The last case, Mr. Speaker, involved a young man called Ndiagui Kinyanjui, who actually forced the DCI to be dragged to a police station, to the court. And I think it was Justice Mwita, now a Court of Appeal judge, who really berated the DCI and, you know, banged tables. But, Mr. Speaker, when it was found finally that Ndiagui was just having his kideri, relaxing in his house, up to now, Justice Mwita has never apologized to the Inspector General of Police, the DCI, or the people of Kenya. So, Mr. Speaker, these three cases, among others, paint a very bad picture, because all of these three gentlemen I've mentioned are role models and leaders of their own right, but they are painting a very bad picture of the National Police Service, but also they are, Mr. Speaker, embarrassing and making fun of serious cases of disappearance, abductions, and forced disappearance, and the victims and the families feel really very sad that some people are acting skits and so forth on this particular issue. So, Mr. Speaker, I thank you.
Thank you, Cabinet Secretary. Senators, with your indulgence, because of time, we have several questions which have not been asked. What I propose we do is to have the questions asked, the CS to reply, and then we take supplementary questions thereafter. Senator Mazayo. You will ask. We'll ask all the questions. Senator Mazayo.
Yes. Thank you very much, Mr. Speaker. Mr. Speaker, my question is to the CS. Interior and National Administration, or Interior Security, as follows. First, maybe I want to say that the minister is, I know he's a hardworking minister, but of recent, I think he has received very bad publicity on...
Senator Minority Leader, you have a question, go straight to the question.
Yes, but I have to introduce what I wanted to
There
say.
is no introducing the question, Senator.
Thank you for your guidance. I want to ask, number one, is what has the ministry, what is the ministry's current strategy for maritime security, and how is Kilifi County classified within the National Maritime Risk Framework? B, or number two, why has Kilifi County, despite its long coastline and strategic position, not been prioritized in the deployment of Kenya Coast Guard services? C, could the Cabinet Secretary provide a report on the status, capacity, and distribution of Coast Guard assets along Kenya's coastline, and clarify the criteria used in their allocation? And finally, what immediate and long-term measures is the ministry putting in place to current equitable deployment maritime security infrastructure and personnel across the coastal countries?
Thank you. Yes, let's take all the questions, then you'll reply. Senator Manzo.
Yes, thank you, Mr. Speaker. Question number 16. A, could the Cabinet Secretary provide a data on the number of individuals that have reported missing since 2022, indicating those that have been found alive or dead, and the number still unaccounted for? B, have the police or other security agencies established who was involved in the disappearances, and if so, could the Cabinet Secretary provide details on the actions that have been taken to bring the individuals to book? C, what measures is the government implementing to address the increasing cases of abductions in the country, and to specifically ensure accountability in respect of enforced disappearances? Mr. Speaker, D, could the Cabinet Secretary provide details on the physiological and other support mechanisms, psychological and other support mechanisms available to abduction victims, and indicate whether financial compensation has been provided to any victims or their families? Mr. Speaker, I had one final one. If you allow me, I can read through.
Senator, because of time, we can't. Senator Ugenda, Senior Counsel, Professor, ask your question.
Thank you, Mr. Speaker. Mr. Speaker, my question is addressed to CS Interior. Number one, could the Cabinet Secretary explain the circumstances under which police officers were deployed to Itim Anglican Church in Othaya, Nyeri County on 25th January 2026 and disclose the identities of the persons who authorized and commanded the operation? Two, what steps did the authorizing and commanding officers take to ensure the deployment and conduct of officers on the scene as consistent with the national, and whether it was consistent with the National Police Service Act? Three, are there internal controls or supervisory review mechanisms that are triggered prior to the deployment of the officers to sensitive civilian settings such as the place of worship? And if so, could the CS indicate whether they were triggered in this case? And lastly, what measures have been put in place to ensure that similar deployments in future are properly approved, documented, and supervised in a manner consistent with professionalism, discipline, and neutrality of the National Police Service? Thank you.
Senator Hamida.
Thank you, Mr. Speaker. My questions are, Bwana Waziri, could you kindly provide a status update on the investigation into the murder of Advocate Kyalo Mbobu, who was shot dead on Tuesday, 9th September 2025, including whether any suspects have been apprehended or questioned? B, what challenges have investigators faced in resolving the case, especially in regard to the closed circuit television, CCTV footage, and other forensic evidence? C, could the Cabinet Secretary outline the steps taken since the murder of the advocate to ensure continuous functionality and rapid access by security agencies to public CCTV footage as a deterrence and investigative tool, and provide details on the current extent of public CCTV surveillance coverage in Nairobi and other major urban centers? D, what measures has the ministry put in place to strengthen community-based intelligence, anonymous reporting channels, and witness protection to improve detection and disruption of violent criminal networks perpetrating targeted killings? And finally, Waziri also outlined the broader security and criminal justice reforms being implemented to address the rising concerns over targeted killings, general insecurity, and lack of swift justice in high-profile murder cases. I thank you, Mr. Speaker.
Senator Mofire. Give him the mic.
Thank you. Thank you, Honorable Speaker. Honorable Speaker, I could get to know from the minister when will the government establish additional evidence distributed national identification, country registration, and the collection centers across Tharaka County and other counties where residents have to travel long distances to access these services. Number two, Honorable Speaker, will the government also consider deploying mobile registration and the collection system to address the accessibility challenges faced by youth seeking the services in the affected counties? Thank you.
Thank you, Honorable Senators. Honorable Senators, we are going to defer question number 18, question number 20, question number 21, and question number 30, and allow the CS to reply to the questions that have already been asked. Cabinet Secretary.
If you may, Mr. Speaker, I will, if you allow me, I'll do it chronologically so that I start with question number 11, and then it flows. On the first question related to Witima Anglican Church, that is question number 11. Mr. Speaker, asked by Senator Ojenda. For part one, Mr. Speaker, concerning the circumstances under which police officers were deployed and the identities of those who authorized and commanded the operation. Mr. Speaker, on 25th of January 2026, it was reported at Witima Police Station that unknown individuals lobbed tear gas canisters inside Witima SK St. Peter's Church during service that was attended by, among others, the former impeached Deputy President Rigathi Gachagua. It was further reported that the attackers were dressed in civilian attire, had concealed their identities, and were operating motor vehicles believed to be associated with the police service. The individuals caused extensive damage to motor vehicles that had been parked within the church compound. Following the report, the Nyeri County Security Team visited the scene for inspection and processing. Inquiry file number 1 of 2026 was opened by the Directorate of Criminal Investigation, Nyeri South, to investigate the circumstances surrounding the incident. Subsequently, the Inspector General of Police directed the Internal Affairs Unit to take over investigations in order to ensure an independent and impartial inquiry, particularly in light of the allegations suggesting possible involvement of police officers. The Internal Affairs Unit has since submitted a preliminary report